Good day. My name is Rachel Isigozo and I'll be presenting with my colleague Carl Ransom. The topic is on designing a primary care clinic that reduces disparities in access to care. What is access to care? This means the ability to obtain needed, affordable, convenient, acceptable, and effective personal health services in a timely manner. Disclosures. I and my partner, we have no actual or potential conflict of interest to this program or presentation. Why we chose this topic. It's known that a significant portion of the US population has difficulty accessing primary care services, and the key implication has led to less preventative care, worse health outcomes, US life expectancy declining, and increased health disparities. Persons likely to face access problems. These are the people without health insurance, minorities, low-income individuals, people with little formal education, people with special needs, disability, people with chronic illnesses. Major barriers faced in primary care clinic are accessibility, availability, and timeliness, which are important characteristics of an efficient and effective primary care clinic. There are financial and non-financial barriers. 18% of US adults experience financial barriers like affordability, while 21% experience non-financial barriers. Affordability is the most common financial barrier, and it is mostly attributed to low or fixed income. Examples are high insurance premiums, co-payments, deductibles that are unreasonable, prescription prices affordability, inability to afford to pay for childcare in order to attend an appointment. Examples of non-financial barriers: geography or location. In rural areas, 21% of Americans live outside the city. Only 10% of PCPs practice in rural areas. In low-income areas, lack of transportation and reliance on public transportation, which can be unreliable. Due to some people's cultural and religious beliefs, there is a stigma about various health conditions and treatments, like mental illness, HIV and other STIs, vaccines, and trust in healthcare due to historical mistreatment. This affects adherence with treatment or follow-up visits. Race or ethnicity. It's been noted that there is a lack of awareness of available services due to low health literacy, low trust, and fear of facing mistreatment or discrimination. This has impacted compliance with health management. Language. 21% of US population speak another language at home. Lack of qualified interpreters to translate correct information to patients at a clinic can lead to miscommunication or misinformation, which causes poor treatment adherences. Time is another barrier that is faced. This could be due to work or school obligation. Use of public transport can take a considerable amount of time, specifically buses in Texas, no subways or light rail. Wait time at the clinic is discouraging, which adds to non-adherence. Shortage of primary care providers. 23 million people in US live in primary care professional shortage areas. This has led to a delay in obtaining necessary medical care.
While it may seem daunting to consider how to tackle this plethora of barriers, fortunately, there are numerous solutions a primary care practice can implement that are feasible, cost-effective, and evidence-based. First, we recommend incorporating telemedicine into your practice, as this will help reduce numerous common barriers such as transportation or time limitations. While this approach requires internet access, many patients can complete a visit using their smartphone. In order to reduce financial barriers, we recommend that practices accept a wide variety of insurance plans, including Medicare and Medicaid, which are primarily used by low-income individuals. For patients without insurance, utilizing a sliding scale fee system based on income can lower the risk that the patient will experience medical debt. Next, primary care practices can improve access to care by forming partnerships with community nonprofit organizations. Doing so will provide opportunities to conduct educational and outreach services while also helping you target underserved populations. Primary care practices can also help improve access by expanding their office hours to include earlier mornings, late evenings, or even weekends. In addition, having a lenient no-show or late policy provides those relying on public transportation a better chance to continue to receive care. In order to help reduce discrimination experienced by patients from a minority population, practices should provide staff training with the goal of improving cultural competency while also addressing common social determinants of health and structural barriers that exist throughout the United States. Patients who don't speak English can greatly benefit from the use of medical interpretive services. In addition, practices should provide educational materials for a patient in their primary language, and regardless of language, use terms that are simple and easy to understand. Practices should form close connections with graduate nursing and medical programs. Doing so will not only provide an invaluable service to the students needing preceptorship experience, but also give those clinics the opportunity to recruit the next generation of primary care advanced practice nurses and physicians. When evaluating applicants, clinics should seek staff from diverse backgrounds and those who express a passion and commitment to improving access to care. Utilizing federal or state programs such as the National Health Service Corps can help steer clinics towards such applicants. To conclude, improving access to care takes a multifaceted approach. While not every clinic will be able to implement all of these strategies, we hope this presentation provides a feasible blueprint that enables practices across the United States to serve their communities.